Good evening to all. Today is our special session titled Human Rights Perspectives in South Asia, and the speaker is Dr. Swati Chakraborty. She is the Assistant Professor and Vice President, Southeast Asia of EDSA. She has also been the Director, International Relationship and Campaign at Nonviolence Project. She has been a research consultant to the National Human Rights Commission in India since 2013. She's a former international fellow of King Abdullah bin Abdulaziz International Center for Interreligious and Intercultural Dialogue. Now, we know that human rights issues have become a major area of controversy during this ongoing COVID-19 crisis. And it is in this light that the Tillotoma Foundation presents this special session on human rights. And we are happy that someone like Dr. Swati is delivering this talk today. So without further ado, I would hand the session over to her. And the audience can interact after her talk is over. Thank you.
Thank you so much, Soham, if I'm not wrong. Thank you so much to the Tillotoma Foundation for this wonderful session. And today's topic is human rights amidst the pandemic, South Asia perspective. As we all know that current scenario is not very good towards the perspective of human rights as of, but international human rights organizations like WHO, United Nations, they are dealing it very, very well. And this particular scenario in the crisis era, as a human being, as a woman, as a mother, as a daughter, I think we need to fight a lot to tackle the in-house and outside world, as well as the partners of ours, our father, our husband, our son, who is actually locked, and they have to do their work from home. They are also very, very supportive towards our responsibility. Human rights is not only giving, it also how you are performing. That is your duties. So human rights and human duties are just the two sides of a single coin. COVID-19 is a test of our societies, of government, the communities, of the individuals, that actually this world is taking a test, a quality test, that we have to perform very, very well. So in this time, with the solidarity, with cooperation, we need to tackle this situation with this virus and to mitigate the effects, often that we may not able to attain the quality and the measures that has been designed and to spread COVID-19. Respect to human rights across the spectrum, including economic, social, and cultural rights, civil and political rights, will be the fundamentals to success to the public health response and recovery from the pandemic. So, first of all, the access of healthcare, the health strategies that should be addressed not only to the medical dimensions, but also towards the pandemic, towards the human rights and gender-specific consequences to the measurable amount that has been taken part with the health response. Treatment should be available to everyone without any kind of discrimination, including the most vulnerable and marginalized. This means ensuring that no one is denied timely and appropriate treatment because they lack of means to pay for it, because no one is being excluded from this treatment and medical terms on the basis of age or because of stigma prevents them from getting treatment. It's very sad that we can see a very, very precious doctor that has been maltreated after his death in Tamil Nadu very recently. So it's a human rights crisis era too, not only the medical terms, with the emergency measures. Government have to take difficult decisions in response to COVID-19. International law allows emergency measures in response to the significant threats, but measures that restrict human rights should be propagated and proportionate to evaluate the risk, then necessary and applied to the non-discriminatory way. This means having a specific focus and duration and taking the list of of the intrusive approach possible to the protect of public health. When states to emergency declared, the states that are parties of international covenant on civil and political rights should meet their legal obligations to provide formal notification through the United Secretary General, regional human rights treaty bodies, including the similar obligations. With the regards of COVID-19 emergency, powers must only be used in legitimate public health goals, not used as the basic of the quash that is distinct to the silence of the work of human rights defenders or journalists, or to take any kind of steps that is not strictly necessary to address the health situation. So the access of media that has been very, very necessary in this crisis situation. Some rights cannot be restricted even during the state of emergency. That is very, very important with the principle of non-refoulement, the prohibition of collective expulsions, the prohibition of torture and ill-treatment, the right of the freedom of thought, conscience, religion, and others that need to be addressed very, very strongly with the respect of human rights. Government should inform the affected population of what is the emergency measures. So the campaigning through the government is very, very important in this situation. Whereas to apply to the how long they are intent to remain in effect. And that should be updated information regularly being published in the government websites and other measurable amount. Because we know that some population is unreachable, like the tribal people, the marginalized people who are not able to avail any kind of information through social media or media even. They need to be also informed very, very crucially in this particular time. So as soon as feasible, it will be important for the government to ensure a return of life as normal, as not use of any kind of emergency powers to indefinitely regulate day-to-day life. That is very, very important, because recognizing that the response must need to be addressed in different phases of the crisis, leaving no one behind. So it is very important, because we are living in the scenario that all society includes people who are marginalized and face difficulties in accessing public information and services for the variety of reasons. Some of them are reflecting into the disseminated to the political dividends. COVID-19 information and response efforts will need to take particular care to identify people who may not risk of being missed or excluded. National human rights institutions like NHRC, for example, in India, civil societies that are NGOs and local communities can assist in identifying people who may otherwise be missed or excluded. So they can be the partner organization in the government criteria that need to be addressed to flow the information without any kind of prejudice to those particular groups may not be missed or been excluded. Housing, that is also another criteria in these situations. So people are being called upon stay at home. That is not the social distancing. We are rather using physical distancing and social solidarity. That is very important to address. So in this vital period, government take urgent measures to help people without adequate housing, who are not able to take care of their housing, the migrants people who are living outside their home and outside their home states. They need to get proper housing and shelters in this particular scenario. Good practice of protecting people living in adequate housing and homeless including, they can be provided and they are actually having their shelters in the houses in the particular places where targeted to the schools, the colleges. They can be stay there for to prevent additional people from becoming homeless. For example, as a good face evictions, when loss of income makes it impossible to pay any kind of mortgage or even pay rents as a tenant, good practice is to mitigate these issues with a human rights perspective. Persons with disability. Persons with disabilities are at much higher risk from this COVID-19. State responses need to include targeted measures to address them. Crisis response measures, health and social protection. Interventions must be accessible to all, that should not discriminate against persons with disabilities or differently abled, we would rather say, not the disabled person, rather they are differently abled person. Physical distancing, self-isolations, and other emergency measures that need to be taken care with the amount of needs who are in need. That is the differently able person who rely on the support network, that essential goods and services should be provided without any further delay to them directly, with the significant stress and confinement. Ensure that decisions, allocations, and the scarce of resources, that is the ventilators, amount of, are not based with the pre-existing impairments, high support needs, quality of life assessment, medical bias against people with a disability that should be addressed. States should ensure that persons with disabilities are not left without support in institutions, nursing homes, psychiatric treatment centers, and the facilities that has been become a hotspot of the pandemic, and take measures to ensure the protection of those who are in such facilities. Access to additional financial aid and social protection is crucial for persons with disabilities and their families, as many of them depends on the services that has been suspended due to this high risk zone. So they need to be addressed carefully. Very importantly, that is our older person at our home who are staying alone. They need to be addressed with a very, very humanitarian way. And older persons have the same rights of the other age group, and they should be protected equally during the pandemic. Special attention should be paid to the particular risk faced by the older persons, including isolation and neglect result from the physical distancing and age-based discrimination in access to medical treatment and other supports. Protocols on the treat should be based on scientific evidence and medical need. Now, people in detention and institutions, people deprived of their liberty, including the person of pre-trial detention and immigration detention institutions, compulsory drug rehabilitation centers, and other places of detentions are at heightened to the risk of infection in the case of outbreak. So there is a high risk of contamination, and physical distancing is difficult to achieve in this particular institutions. Their solution should be specifically addressed in crisis planning and response. The government should take accountable, measurable amount of attention towards their social safety and protections. States should adopt special measures to ensure the information and quality to prevention and other health care for the all person deprived of their liberty. States should urgently explore the options for release and alternative to detention and to mitigate the risk of harm without places of detention, including for persons who have committed minor or petty or non-violent offenses, those with imminent release dates, people with underlying health conditions, and those in pre-trial or administrative detention. People detained without legal basis should be released, as should people in the commonly drug detention centers or treatment programs. There should be a monitoring and evaluation continuous process with the children who are entertaining the detention in their homes, and states should release all children from detention who can be safely released. Information and participation, that is very important. Relevant information on COVID-19 pandemic and response all people without exception, without any kind of exclusion. This requires making information available in readily understandable format and languages. That is very important. Sometimes we missed some people, and some misinformation and misleading assessment can be reached without appropriate translation. we need to address each and every individual in their respective language, so each and every people can be addressed with this. And this including indigenous languages and those of national, ethnic, and religious minorities. Adopting information for people with specific needs, including the visually and hearing impaired, and reaching those with a limited or no ability to read or no internet access. Because nowadays we are more and more reliable with the internet source. So we need to address that if no one is accessing the internet, they also shouldn't be missed in this particular pandemic situation. Internet access is essential to ensuring that information reaches those affected by the virus. Government should end any existing internet disruptions or shutdown and keep the internet on. State should also work to ensure broadcast with the broadest possibility of access to internet services by taking steps to bridge the digital divides, including the gender gap. Because gender gap is a major issue in this. The current generation is more and more accessible towards the digital era, rather the old age people who are not being very familiar with the internet and the digital devices, they also need to be addressed, and they should get proper adequate information about COVID-19 without any further delay. Medical professionals and relevant experts must be able to speak freely and share information with others and the public. Journalists and the media should be able to report on pandemic, including the coverage that is critical of government responses without fear of censorship. Because we can able to see, even in India, even outside India, Nepal, Bangladesh, Pakistan, Bhutan, Sri Lanka, they are not easily accessible with a journalist in this travel ban situation. But we can actually avail the webinars, the web chat, the telecommunication, and the information can be reached throughoutly very easily. But with the censorship, even within the India, we cannot able to achieve the appropriate information of state-wise COVID patients and other informations too. So the hiding information is a major human rights issue in this pandemic situation. We should have appropriate information and the actual number of COVID patients who are recovering, how they are recovering, what is the measurable amount of recovering patients that we need to be addressed throughoutly with an international and national levels also, to counter false or misleading information that fuels fear and prejudice. Incorporating with the perspective of voice and knowledge of women in outbreak with the preparedness. The lack of preparations is one of the major issues in this era, because we are not prepared that what will happen next. We don't know. The risk and uncertainty is different. Here we are facing the risk and the uncertainty. The response of essential goods and services, including ensuring their representative and the leadership role in the global, regional, and national COVID-19 spaces, is very important in this way. Now I would like to discuss about the stigmatization and xenophobia and racism. That is a very challenging issues in this COVID-19 and afterwards too. COVID-19 are actually showing us the wave of stigmatizations, discrimination, racism, and xenophobia against certain national and ethnic groups. As we all know, that the US also already stigmatized the COVID-19 as a Chinese virus. And we all actually expecting a third world war kind of situation in this era. We are waiting for some exciting news that will come out soon. But is that really true? Is that really true? That always hindering our mind? The discrimination, the racism, the xenophobia against certain national or ethnic group, will it actually solve the problem? No. So we must address the exact situation, not just to spreading the false news or false information against any particular ethnic group. We need to work together to push back against the trend, including by referring the disease as COVID-19 rather than using a geographic references. Political leaders and other influential figures should speak out forcefully against the stigma and racism that crisis has generated and must at all cost to avoid any kind of fueling of fire such discrimination. States should act quickly to counter rhetoric that stoke fear to ensure their responses towards COVID-19 do not make certain population more vulnerable to violence and discrimination. The dissemination of the accurate, clear, and evidence-based information and awareness-raising campaigns are most effective tools against discrimination and xenophobia, which feed on misinformation and fear. Additional efforts are needed to monitor incidents of discrimination and xenophobia. With the migrants and the displaced and refugees, they are also in crisis. Migrants, internally displaced persons, refugees face this particular risk as they may confine to the camps and settlements. With the migrants and refugees, they are facing obstacles of accessing the healthcare, including their language and cultural barriers, cost, lack of information, discrimination, and xenophobia. Migrants are irregular in the situation that can be unavailable with the unwilling to access healthcare and provide any kind of information to them. How this COVID-19 will impact into the social and economic perspective. In right to education is a major crisis in this era. Most of them cannot able to aware about the digitalization of education. E-learning is not at all an easy task for those who are not able to actually access. So right to education is kind of a step towards this. Online learning and specialized TV and radio broadcast can be a solution, but there is also some challenges are there. Social protection schemes that should pay particular attention to children due to the heightened of vulnerabilities they face on their every stage. Food, privacy, and the children, because children are being very, very under protection in this era. They are mentally and physically blocked into certain phases in their houses, respective houses. So that should be addressed very carefully. Gender issues is gender-based violence. Domestic violence is a criteria in this COVID-19 situation. Now, if we discuss the country-wide situation in the Southeast Asian perspective, the COVID-19 and how it deals with the human rights situation in India particularly, life is not same for all people in India. A nation with 1.3 billion is up against the enemy that is actually invisible. So yet it seems to be invincible too. The present generation have never witnessed such fear of any pandemic in their lifetime. So this is a lifetime opportunity for this generation and for us also to know about this situation, that how we can actually fight against it. As India prepares its defense against total transmission of virus, public health measures, community preparedness, practice of social distancing have become critical because people are not serious at all to listen to the government decisions. So the fight is not going to be very easy. On the eve of March 24th, until now it is up to 3rd of May, we don't know what will happen next. The central government in India and other state government also supporting to transmission of virus. But the situation towards the human rights is not very, very good. Even this time also, rape has been conducted to certain part. Also, the domestic violence is at high risk because people are stuck into their home. Mental blockage and continuous agitation has been fueling up towards this situation. So domestic violence is on high risk in Indian perspective. The outbreak of COVID-19 is equally dangerous towards the perspective of children who are stuck to their home and to all sector of the society. Everyone is mandated to follow the protocol and social distancing. The pandemic will significantly affect on the workers' life of the migrants workers and the laborers who are actually losing their job. Not only that, the IT, the information technology, and the other sectors are also high risk to lose their jobs. So job is a high criteria, and right to it, economic sustainability, we don't know what will happen to the actual sustainability. We call it the migrant laborers, state vendors, domestic maids, domestic helpers, construction workers. So this is the period where we experience the same amount of uncertainty. Now I would like to talk about the situation in Nepal. Nepal currently has 3 confirmed of 1 recovered cases of COVID-19 from March 26, with the 758 tests has been taken since March 24. The country has been also under lockdown. The government took critical protective steps, which has received public support also. Huge number of Nepalese immigrants and migrants workers have traveled from India to Nepal, and which is also 2 cases that has been confirmed with their travel zone. Since last week, most people have left Kathmandu Valley for their home districts. They have left. They are fear. So the lockdown is a reduction in the travel accessibility, and possible measurement has been taken up by the government. The real number of cases can be significantly higher given to the test results. That is, the rate of taking the test is low. So many pre-lockdown travelers from various ports may not have to strictly follow the government 14 days self-quarantine requirement. So people are not actually listening what government is talking to them or addressing to them. As well as we anticipate that this lockdown period will lengthen. The duration will be lengthier. Most Nepalese are worried about the continued and effective availability of their basic food, because Nepal is mainly dependent on their agricultural and farming. Farming and agriculture is also being disturbed with the supply methods, as well as with the medical supplies also. That is another trouble for the India too. Most of the medicines that has been the ingredients mainly, there has been exported. The import also been restricted, that has been coming from outside India. Even in Nepal also, Nepal is also highly dependent on the medical support and medical supplies, looming a large number of economic issues for daily wage workers who are daily earners. They has been also under criteria of the in this uncertainty era. The micro and small enterprises employees who will lose their jobs and markets in this current and post-pandemic economic order. So we need to wait that what will happen. The uncertainty is already there. Now being able to test the potential cases. Beyond the health implications of COVID-19, country like Bangladesh doesn't have the fiscal capacity, the economic capacity to prolong the lockdown period. While the general holidays will help flatten the curve, there will be a far-reaching consequences on people's livelihood. As one of the top 10 remittance earning countries in the world, Bangladesh rural economy will be hit hard, because Bangladesh is highly dependent on the immigration laborers. Huge number of laborers are working outside Bangladesh, and they are working mainly in Dubai and other Arabic countries as the domestic helpers, as the workers, construction laborers, and others. 2 most popular destination of Bangladesh migrants worker is UAE and Saudi Arabia. They have been returned. More than 65,000 people have been returned to Bangladesh between January and March of this year. That is a very high risk for a country as an economic burden towards them. So, right to economic stability can be questions in this situation to Bangladesh. Bangladesh will see further decline in remittance, which will threaten the livelihood of millions of rural families who depend on migrants workers. So now, I really would like to continue, but time is shortened. So thank you so much, Tillotoma Foundation, for giving me the opportunity. And I really welcome you all to ask me the questions now.
Yes, ma'am, I have a question. Myself, Jyotiraj Pathak, I am from Assam, Bodoland University. Madam, you are talking about civil rights, political rights, and in the context of India, Nepal, Bhutan, Pakistan. It's okay. Another issue is, say, the digital divide you have raised. So because of that lockdown, almost all the educational institutes are shut. So in this context, even our authority also saying that we must go for digital classes, distance classes like that. But is it feasible for the countries like India or for that matter for the whole South Asian region, where a large number of students are coming from the very poor community, poor background? So is it feasible? And if we are denying them the right to have that digital advantage, don't you think that it's a violation of human rights on their part?
Yes. Absolutely, sir, that I also agree with you, and that already I told you that it is not been very, very feasible, because most of the area, even I worked with the tribal area, that is not been very feasible with the digital education system. But there should be some alternative methods, that if we actually record the lecture, record the material, and can post them, and one of them can access those, can print out, and just put the printout of the material in a board, and one by one, with the social distancing, they can come over there and can read those material. So that can be a solution. I'm not the expert of that one, but I'm just suggesting one solution. So I hope that with this, with this learning process, we also can actually know that how we can solve this e-digital method of learning. So I really hope that we need to think over it, and our government, there are experts there. So I really hope that this problem will be solved, because it's a real problem for the students who really want to know and do not want to miss their class, but they don't have the internet. Most of them, they don't have internet actually. So I hope I answer you. And I think we have one more question from Saurabh Ghosh. Ma'am, can you discuss how racism is occurring during this pandemic? Yes, Saurabh, I really want to address this question, if Tilotoma Foundation allow me to do. The racism is actually happening in US already. In US-born Chinese students, they are the target of bullying. And they are US people, but people are actually accusing them that go back to China, because they are not Chinese, they are US. Same thing happened to our Northeastern friends, Northeastern fellows, who born in India, who are Indian. They look like Chinese. And I'm very much sure that after this COVID-19, whenever they will return back to their university, their colleges, they will be targeted, that you go back to China, you are not Indian. This thing happened to Delhi. We already know that. So I'm very much afraid of that. Thank you. I think I answered you, Saurabh.
Discussion. Okay, I wanted to ask you, you did not, one of the issues today, today in the first half, I was part of a dialogue, the Arogya Setu dialogue. So there was a lot of discussion from both sides, actually, whether it is a violation of, privacy, or whether it is an effective measure on part of the government in this crisis, and both sides taking very different views. So I would like to take your view also, so that our audience can also know.
Please. Oh, okay. My view on personally in this. I think to some extent it is very, very good practice to to stay at home in this particular, because our graph is actually upwarding. So I think without taking the measurement of staying at home, or there is no other option at all.
No.
In my personally.
No, I was talking about, the government has launched this app called Arogya Setu app. That app basically takes, some specific personal information from you, like what is your age, what countries you have traveled in the last 30 days. So the government is storing, and one of the provisions of that app is that the government won't be responsible if your information is, somewhat unauthorized access or unauthorizedly used. So these are the provisions that are there. The Arogya says, it has already hit 50 million downloads on Play Store if you check it. So government is vehemently promoting it. It is, I think, a part of the Niti Aayog project also. Today in the morning, that conclave, even the Niti Aayog program director was there. And so they are saying that they have adopted all necessary safeguards, but the human rights lawyers, etc., and also the legal fraternity, press freedom, etc., also technical freedom, etc., they feel that there is some kind of a violation of privacy, etc. So in that regard, I was asking.
It is indeed, Soham. I really agreed with you even this way. Okay, I totally agree that it could be a human rights violation, because in future, if someone is taking your private information, and that you're supposed not to share with others also, and I'm not sure that whether our Aadhaar card is also safe with them also, because it can be cloned and can be used in a different way. So I don't trust actually the government situation, that how they are tackling the information very privately or something. So it is actually, I'm on the side of the human rights defenders, that it could be used in the violation of human rights in future also. So even in our state level, I think call Didi or something. What was that phone call number, and they're also taking each and every information. So each and every information has been recorded, and it's not the easy task that to do that.
Yeah. Also, you talked about the ICCPR. Now, one of the lawyers, they were talking about saying that there are provisions in the ICCPR that allows government to relax, or somehow go away from the ICCPR guidelines when there is a public health emergency. So legally they can use such provisions also. I mean, within the international law there are sort of loopholes that allow governments to.
Yes, because each and every article you can see the protocols, the optional protocols. So each and every international and national, even regional, whatever article we have some loopholes. So to safeguard the existing government, and the government is always trying to change and modify according to their need. So it is very, very easy. Even our Epidemic Disease Act, that is in, I think 1857 or something, that is continuing till now, and I think some modification has been already done or going to be done in future very soon.
I think there's a question from Shorab. You can check.
I think I have answered already. Okay. Yeah, I do have some questions specifically during the period of through NHRC have issued notice to states regarding the act of police and other public service men towards common people. But is that taken under consideration by the states, and is that under governance by other states' human rights commission? Shourav, I would really like to answer this question as a human rights NHRC. I was working as a research consultant over there. You know the role of the NHRC and other state bodies of the Human Rights Commission. Most of them are playing their role to give the recommendations only, because the commissions is the organization, they have only power to recommend, just to give recommendation, and it is not easy to cope over the police or other services that beating a person who is roaming around without any reason. To some extent it is good, but when people are need, who are the daily earners, who are the wage earners, beating them, and it is not the solution, because food security, shelter security is high priority for them. It is not the luxury, it's the basic human needs. So the notice against any kind of degrading act by the police authority is not acceptable as a human rights perspective. But if we can see to maintain law and order from the perspective of government, it is a very, very urgent need in this particular crisis period. And but it is the taken care consideration by the states and under governance by other state human rights commission. I'm not sure that other human rights commission in the states, they are actually functioning very well. I don't think, because publishing any kind of notice or reports is not the thing, or it's not the duty of a commission. The duty of the commission is after recommendation, you need to evaluate and monitor it in a very, very crucial and critical way. You need to analyze the reports, and you need to analyze the actual reports, not even the sent reports by the states. You have to inquire from your perspective, your way of understanding. So in this way, you can actually understand the given report by the state or by the central even, and you can evaluate with your inquiry report. So you can just compare both the report and able to understand the actual situation. If I'm not wrong, I answered you, Soham.
Okay, it's not actually Soham Ghosh is Simran Ghosh. It's just her account's name. So I was thinking, where is she? Okay, so okay, I get it. Okay. So anyway, I had basically because this session was titled that it is on South Asia perspectives, and since we have even in our the introduction thing that we put up there, we said that South Asian countries have this governance problems, etc., and we are having this, whether how stringent the laws are affected. But I'm at this almost at the end of the discussion. I'm going to provide you like a counter argument to you, what you say, or in general the perception that we are discussing. That you see, that the very basis of human rights is human lives being saved, and since this is not a war in general, and this is a human rights emergency, or rather a public health emergency, in this respect, if the government is saving lives, so for instance, if we are having like say 750 deaths in India, and we are having 50,000 deaths in United States, or more than 1 lakh deaths in Europe, so in that respective, actual human lives are being saved, and if human casualties at a very minimum, then even if the other government stringent measures which may cause some privacy violations, or may people getting a little bit beaten up with a stick, which are not causing any loss of life. So in general, if we can limit casualties to a great extent, isn't that in other ways a great success even in terms of human rights? What is your take on that?
No, that's what I support you, that it is not the casualty of or the beating up of the common people for the goodness of the in future life. It is good to some extent, of course, but if who are in need, for example, if a daily earner is going out for the daily food, or if actually his baby is crying for the milk, if he is going out knowing the reason, assessment should be there. Then beating up without any reason, people are gathering and just doing fun or doing the party over their beach. In the US also, we can able to see that in Texas, some of my friends, they're taking 2,000 people actually gathered to protest that why lockdown should be extended. So that is not the issue. US is also fighting, Europe is also fighting, we are also fighting, because this is not the war situation, because this is I think war against the virus. So